So it's great to be here. Lots of people involved in this project. Patsy's involved in the project. Wendy works for some of the agencies in the North Shore that are supporting this project. Terry Ann probably has the longest history with this project. And so I'm going to call on her and others as I talk about it. Since 2007, the Human Rights Council, Bernard Richard wrote a report about services to youth mental health. And it was realized that the province wanted to create an integrated service delivery model. And it was piloted back in 2013. And from the get-go, I'll be very short about it. It was that it really didn't serve First Nation communities. And in particular, the North Shore, which is composed of 7 communities in the northern eastern part of the province, were dissatisfied with that model. Terry and a group of her colleagues did an initial report on looking at a First Nation model. And Terry, you want to just give a brief blurb about that process that you did coming up with the model? Your report.
I'm wondering if I came in late after that report, though. I don't know if it was more Kathy that
Okay.
part of that. I'm just trying to remember initially.
Right.
But yeah.
So this report came out saying it ain't working. Here's some ideas about to make it work and giving more control to First Nations. And it got lost. It was never responded to, but it was found by another community.
Oh, that one. Okay. I'm on a different page. I'm talking about like way
Okay.
back. Okay, sorry. Go ahead.
And, okay, so there was a desire to revisit that report and make it a little bit larger for all the North Shore communities. And so what we did is we brought together representatives from community and agencies that support youth. And that was probably one of the first regional operations committee meetings we created, and Terry was there. And she and others said, this is what the model needs to address. And again, I don't want to put words in Terry Ann's mouth, but what was very clear was they did not want a purely clinical model. They wanted a more holistic model that engaged a whole, continuum of supports from informal to formal. And so we left that first meeting going, okay, it's going to be different. And how do we, what's the conceptualization that we need to use to steer people's dialogue? And so, again, it was by happenstance. I had worked with Patsy back in the 80s, 90s. No, I don't know. It's a long time ago. And so got back with Patsy and talked about the project, and she brought up, the Circle of Health as a way of thinking about our discussions. So it did drive our initial discussions about what do we want to get out of community and agencies in terms of supporting young people. So we did that. We went back to the government of New Brunswick and said, we can't come up with a model unless we engage communities and, get consensus about what it is they want. We were doing it through the regional operations committees. So the representatives from child and family, health and education were coming to these meetings, but it wasn't getting the wider population of citizens in these communities having the opportunity to speak. So we did get some pennies from GMB, and what we came up with was, you'll see on the first slide, Tiffany Labilois, who's a colleague, Terry Ann's a director of ed up in Eel River Bar. We engaged her to be one of the community facilitators to talk about what services, what do parents, people need in communities to support youth. So we, over last winter, January to May, engaged community to give their opinions. And maybe what I'll do is I'll just go through it very quickly. Terry and Kathy organized the consultation in Netotag, and so as we go through this process, Terry, if there's anything that comes to mind doing it in your community, please throw in some comments.
I think, sorry, I was a little thrown off track because I was thinking way back when Rachel was with us, that initial proposal that we did. And then I guess the initial feelings, like when we first were told that we had to go back to the drawing board about this, was very frustrating. However, I do feel that now, bring all of the people that are coming together, we're really building a very strong network of people in our area. And I do feel, Brian, though, I have to give him a lot of credit here, because he's been here for a very helping our schools in this area of mental health. And I have to say that all of the suggestions really, we're really, now we're starting to work well together. Brian, I shared this with Patsy and the board at one time when we were discussing how to bring First Nations together and how complicated it could get.
Yeah.
So I had to share.
Still is.
Yeah, oh yeah, totally. But I really had to share a lot of that complication does come from our traumas.
Right.
Too, and the conflicts, and your suggestions of us, even like with the training for the the facilitator training there for the third
Mediation.
yes, sorry. I find that was a turning point, really, for us all. We worked out a lot of stuff in this training, and at the end of the day, we all had a similar goal. And I don't know, I just find that that's really so helpful, and the roots are from this circle of health, like all the I didn't, yeah. That's my viewpoint, and I didn't realize how big even ASI and Circle of Health, how really deep this really went, or how far the history is. But I really feel moving forward, like we really have to take this model, and of course we'll always have our own little kind of spin to it, But I think now we're really going to get somewhere. And there's such a good team to fight for our kids, and I use that word fight because initially, every time we have any kind of partnerships, there always seems to be this conflict. But the peace is starting to come for all of our groups. And yeah, anyway, I guess the bottom line is that we really started to see all the gaps in our students, and especially I find COVID really emphasized our gaps a little bit more. Our kids really are struggling, and this model of Unkudasi, I think, is really just really kind of highlights what we want to do with the kids. We just want to kind of the true ISD model, and that's what I always felt like. That's really what we want. We just want to wrap around the kids. We want to use we want to have involve our grandparents, our aunties and uncles and cousins, and to help heal our youth and our communities, I guess. I'm not really sure if I answered the question.
No, you're good at giving the context, and there's a lot to the story.
Yeah.
And Terry Ann's mother is a language keeper for her community. So the name of the project when we went out is Unco Dasset, which means to put your arms around. So that's where the name of the project came from.
Yeah.
So again, we went to communities, we arranged a meal and discussion, and this was the process that, we went through. It was all audio recorded and videotaped with permission of members in community. We followed OCAP principles. So all the data that we analyze qualitatively from discussions is with community. They own that data. And so, I'm going to talk very high level and not about a lot of detail about particular communities, unless Terry chooses to volunteer that, what we went through. So again, I'll go through this quickly because it's supposed to be 10 minutes and what we went through. No, that's all right. Don't apologize, Terry. We'll go through this. So we had every time we had an elder and smudge to set the tone for our discussions. And again, one of the things is that it has to be culturally and language sensitive. And so with this project, we were going to have ongoing knowledge keepers, language keepers as part of this project so that it is informed by First Nations perspective. Again, we're very clear about creating a safe and welcoming space. And it was amazing to do that with videotapes and audio tape going on. The people that worked with us were incredibly respectful, and we didn't have any complaints of doing that process with them. And again, we looked to showcase what's going well in your community, like what do we give kudos to, and looking at promoting healthier communities going down the road. So those were the objectives of the sessions. Again, I've already talked about the background history. The ISD model doesn't work in the public. It doesn't serve First Nations, and we're coming up with a model. And so the community engagement, the importance of community engagement. While we were doing the community engagement sessions face-to-face, we had surveys that community members could complete. So there was an opportunity to get multi-informants with respect to the needs that we're trying to get at. And again, most of our sessions were stories. And the pleasant, nice surprise is that people wanted to be asked what they thought. And it was never a problem to have a discussion. That was never a problem in any community. And if anything, they wanted us to come back and talk with them more about what's going on. So they want to have a voice. And they also, in terms of education, they want to know what's out there. They want to know what they can do or get for their kids in terms of their children's education. So while we thought initially we'd do a little bit of engagement, we realized you can never do enough engagement. So we're going back and back, and this year we're looking to engage the knowledge keepers and youth in the project. Yeah, so I've already talked about this. We're engaging. We had surveys. We followed OCAP for storage and management of data, analysis. All the audio tapes were transcribed, and Nikki Smith and PEI did the qualitative analysis. So we developed themes for each community that would be representative or could be placed within the circle of health. And what we were charged with by senior management and the chiefs was that year was to come up with a model that a conceptualization of an ISD model that we could present to chiefs to subsequently go to the government of New Brunswick to negotiate support, sustainable funding to make that model go forward in the upcoming years. And again, Terry Ann, if there's anything that's hitting a point here, you just chime in. Yeah, so the goal I've already stated is to engage First Nation communities in designing culturally sensitive services that will increase capacity to improve health and social status of the First Nations infants, children, and youth and families. So while we used the Circle of Health and we used it in our consultations, we also found other things that were interesting. We know the Thunderbird has a First Nation continuum of health that's out there. And we also know that the Nunavut came up with a study, but theirs was more focusing on language. And so if you looked at how they thought about, and I don't have a pertinent example, they would have combined some of the ring things because of language and culture. So again, one thing is that, the Wheel of Health, one thing we talked about was, could we get a translated version of the wheel for First Nation language purposes? But language is very important in this discussion.
And I think, Brian, one of the things going back even further were that the questions that were used in the survey, there's a lot of time spent designing the questions, both for the survey and the engagement, from starting with the Circle of Health, right?
Right.
So that we'd be more upstream. It was not just looking at services, but more looking at the capacity and the community pieces. So I think I was engaged initially just to do a presentation on the Circle of Health, and then I got hooked after that. And so it was an amazing process for me in terms of learning. And I'm listening now to what you're saying, and I'm getting a lot from it too. So keep going.
Good.
I just wanted to throw that part in.
Okay. And so again, one of the things with the Circle was that in terms of the Regional Operations Committee, it was very understandable, usable. We had concerns about community, how understandable it would be for them. So that got us into these questions. So these formative questions that could elicit response and that you could take and then lay into the framework. So we talked about people's general health and what's your hope for for today's session. We talked very generally about the variables, the determinants for people. And then we had them, in groups. Sometimes it was too small. It was a whole group, one group activity. And in some places there was debriefing after the smaller groups were formulated. And again, these are the breakout sessions. What do our children need? Wraparound services. What does that mean? For communities to be healthy spaces, our children, youth, they must. So these were the probe questions that people discussed among themselves. And then we told them about in the model, the questions that Patsy had talked about. How are we going to involve, who we're going to involve and whatnot going forward with the model. Terry, is there anything that strikes you about the one in your community? It was a bigger one. It was one of the biggest engagement sessions. It had student representation. It had public school representation.
Yeah, that's right. It
It
did
was
have that. I like that part. Yeah.
Yeah.
Because we're now trying to have a better relationship with the high school too, like the staff.
And we're going to talk about that tomorrow.
I guess for me, like, to share with everybody is to really, and I think everybody knows this, but I always feel an obligation to share this, is to always bring, well, of course, reconciliation, but to always bring up the residential schools, the damage and the abuse that has happened, and our need to and I'm trying to find a good word, but I always say reverse the effects. But ultimately, every time we have these discussions, it, like, everything always goes back to those roots of, you know, when our traumas happen, you know what I mean? Or, I guess the rate of our traumas in our communities to create unhealthy families really did stem from these schools, you know, because of taking away the children. And I always like to bring in my own story, like my own grandmother was 3 when she, actually my grandmother was from PEI, a community in PEI, and she was taken to the school in Nova Scotia when she was only 3 or something like that. And didn't leave till she was 16. So my generation, since we never talked about any of this, I just grew, like, understood a lot of dysfunction and didn't understand where a lot of this comes from. You know what I mean? Like, as far as our situations now, that's why a model, the model that was kind of given to us or placed, or, you know what I mean, didn't work because it never ever took in that history that we have. So these community engagement sessions, I feel, well, for our community, and I'm sure that there was common themes with all the other communities, always take into these, always brings these stories forth. And like our lived experiences and really what we're trying to do and how difficult it is to maintain our relationships in family, and then plus trying to heal and then, you know, and to work with people. Because this is hard stuff to face. And everybody wants First Nation content and First Nation representation, but we come with a lot of baggage. When we come to these sessions, that I think people who are not familiar with working with us probably need to understand. And, you know, and that's why I think so highly of Brian and the teams too, because I know initially when I first met Brian, like I kind of put all that out there too, like this is what we, you know, this is why it's so difficult. And he's just like, okay. And then bring some solutions that work for us.
Mhm.
You know what I mean? Like this moving the social emotional learning. And again, I embrace this so much because our ancestors, our, you know, my grandmothers and grandfathers were never given a voice. So I think that's why this works so well, Brian, when you do go to the communities, and like you said, the people just want to keep talking because it's like and then we remember more things, and then we realize, oh my gosh, other communities aren't like this. Oh my gosh, you know, this is not your reality. And then we kind of like, oh wow, we're really, you know, it's challenging, but we are resilient.
Mhm.
And you know, and but it's yeah, these frameworks and these kind of models are really really helpful to work, I guess, to help people understand where we come from too. Like you explained the circle of health. You know, I think at some point we'll be able to kind of build a model based off of the circle of health and share all of this. And that's the only thing that I would like to add to this is to always recognize our residential school history and all that, you know.
So Brian, I just want to thank you, Terry Ann, and I'm thinking, Brian, in terms of time, I'm wondering, can we move forward on the slides and build
Oh, yeah.
on the insight that Terry Ann has offered us? And
Yeah, so the slide is that what are the challenges and whatnot? We're hearing some of them, what skills are needing. We hear education, training, common experience, training people to have common language on stuff. You know, talked about mediation, social emotional learning. It's not just us. people in health, people in child and family, people in community get the same opportunity. And so that's it.
And
And sorry,
respect.
yeah, respect.
You
for
know,
sure.
I feel like
Mm.
when we've worked with governments in the past, like that's what we were always saying was the lack of respect, like
Mhm.
you know.
So we have an initial model that we wrote in terms of report. We, in June, gave it to the chiefs. They said, go for it. We've met with government. We've had our first sit down to get the model funded, and we've received positive reaction to that. And so we're going on to the next steps there.